Rare but still dangerous, the European Medicines Agency says the AstraZeneca vaccine for COVID-19 is linked to blood clots, but it insists the benefits outweigh the risks. So should people be worried? This is Inside Story. Hello, welcome to the program. I'm Hashem, Ahelbarra. Many countries have been relying on the AstraZeneca vaccine to get them out of the coronavirus pandemic crisis. But there have been problems from supply to side effects. Now European regulators say the vaccine can, in rare cases, cause blood clots. The UK is to offer alternative jabs to young people who appear to be at more risk. But both the UK and EU say they are still confident in the AstraZeneca vaccine's effectiveness and safety. There have been fewer than 80 cases reported in the UK, despite more than 20 million being given out. But even so, that's caused a reaction.
The reported cases of unusual blood clotting following vaccination with the AstraZeneca vaccine should be listed as possible side effects of the vaccine. Based on the current available evidence, specific risk factors such as age, gender, or previous medical history of clotting disorders have not been able to be confirmed, as the rare events are seen in all ages and in men and women.
The first possible connection between the AstraZeneca vaccine and blood clotting was made in late February. Since then, speculation, research and reactions have been mixed. Many medical bodies carried out investigations but failed to come up with a link between the jab and clotting. Even Emma Cook, who you had just heard before, said the EMA didn't think the two were related. But more than a dozen countries temporarily suspended use of the vaccine. Austria first, then France, Spain, Germany in Europe, and then Indonesia, Thailand and Democratic Republic of Congo. Now, with the latest moves, many countries are introducing age limits for the drug. Australia, the Philippines and a handful of EU countries have all halted AstraZeneca jabs for people under a certain age. Oxford University, which was behind the creation of the vaccine, continues to stand by its work. In a statement, its professor of pediatric infection and immunity said, "Safety has been our priority throughout the development of the vaccine at University of Oxford in 2020, and we are reassured to see that safety monitoring continues under the close scrutiny of regulators and public health authorities as the vaccine is rolled out around the world." The identification of rare cases of blood clots, which might be associated with the vaccine, shows that the safety system works and has also allowed the UK and the EU's regulators to conclude that the benefits of vaccination continue to outweigh the risks, putting in measures to help mitigate any possible risk. Let's bring in our guests in Cambridge. Chris Smith is consultant virologist at Cambridge University and podcast host of The Naked Scientist. In London, Oksana Pyzik is lead on the outbreak of infectious diseases for the University College London's Global Citizenship Programme. In Barcelona, Jeffrey Lazarus, head of the Health Systems Research Group at the Barcelona Institute for Global Health. Welcome to the program. Chris, the finding by the European Medicines Agency now about the link between the AstraZeneca and the blood clots, this should be really bad news for a company that has been battered by a series of setbacks.
I think the Chief Executive Officer, Pascal Soriot, has said he kind of regrets going down the path of offering a vaccine which makes no profit for AstraZeneca, which is the decision that they took. This should be available at cost. It was a wonderful gesture. It seems to be somewhat thrown back in their face. Yes, it's tricky, and obviously one is very concerned at the moment with the concept of vaccine hesitancy. One of the crucial things about getting this over the line and getting the pandemic under control is that we have the support and trust of the general public, and that translating into high uptake of vaccines, which will suppress the spread of the virus, and it will translate what would have otherwise been lethal infections into non-lethal infections. With this kind of image problem that the vaccine's currently labouring under, that could be a problem going forward.
Oksana, what do you think will be the immediate implications of the latest finding by the EMA?
Well, the EMA still have said that the benefits outweigh the risks, and actually they have not defined any age-based recommendations, but countries are choosing to do so, restricting to above 55 in Brussels and over 60 in other countries as well. So we do see that there is a variation here in terms of the interpretation of what the European Medicines Agency has concluded, as well as the UK body, the MHRA. What we see as well is that if we consider the overall benefits of the vaccine, not just in terms of focusing on mortality rate, but younger people can also be affected by things like long COVID. And there was a recent study in the Lancet which showed that 1 in 3 people actually went on within 6 months to receive either a neurological or psychological diagnosis. And so we really do need to ensure that this vaccine rollout continues to avoid greater burden on the healthcare system.
Jeffrey, how do you explain the different interpretations of both the EMA, which says there is a link, and the UK regulators who say that there needs to be more investigation before establishing facts?
Well, it's difficult to explain, how the bodies came up with different findings, but as mentioned, the European Medicines Agency has, for the second time, said that this is a safe vaccine with very rare side effects, and it's common to have side effects with any vaccine or any medicine. So it's completely safe to take it. Now that different European countries have defined different age groups is their decision. The important thing is that the AstraZeneca vaccine gets used. And if the Europeans aren't going to use all the doses available to them, then that's more doses for the rest of the world.
Chris, is it political in a way or another that the UK regulators are saying, first of all, as far as the causal relationship between the vaccine and the occurrence of the blood clots coming together with the low platelets, which are the main reason why we're seeing those fatalities, is considered plausible, however, it has to be confirmed. And for it to be confirmed, this could take a body of work and research and data.
A good way of thinking about this is to look at the timeline over the life course and the risk profile. So a person who's in their 80s may have, say, a 10% or higher chance of succumbing to severe or lethal infection with coronavirus, whereas someone who's 18 rather than 80 may have a 1 in a million chance of having a severe outcome if they catch coronavirus. Now, if we map onto that the vaccine has a side effect or complication rate, potentially, of about 1 in a million. That's roughly the rate at which we're seeing these blood clots that might or might not be associated. But let's assume they are, 1 in a million. So if we vaccinated 1 million people, we might therefore expect to have 1 person with the complications. Now, if those are all 80-year-olds, for 1 person with the complications, we've saved 10% or 100,000 lives from coronavirus. But if you contrast that with an 18-year-old, we've caused 1 person to have complications, and we've prevented 1 person from having complications. So that ratio of the risks versus the benefit is quite different when considered across the range of ages. And it's that has provoked the regulators to say, we don't think there's a serious issue here. And the fact that they've said, if you've already had 1 dose of it, carry on and have a second dose, even if you are in the 20 to 29-year age group. But because we do have alternatives, and until we get the data, we don't want to hold up the vaccination process, because vaccines really do matter and they do save lives. Therefore, let's offer the people who might be at a risk a different vaccine, while we simultaneously continue for those other people for whom that risk-benefit analysis is absolutely clear. It's a safe, very effective and life-saving vaccine.
But this is the problem, Oksana. The the finding of EMA itself is going definitely to create some problem among the people who are definitely going to be more skeptical now. And this is going to create huge problems for AstraZeneca, which was hoping that its vaccine, widely touted as affordable, easy to administer, likely to compete with Pfizer and Moderna, that image itself is shattered in a way or another.
Well, I think the flip-flopping certainly hasn't helped. Originally, we did see that the older groups were not vaccinated due to the fact that there was the idea or the feeling there wasn't enough data on this. And then that's now been reversed in the other direction. So I do think that the surveys so far do show that there is a dip in confidence. What's also interesting is that due to the different strategies in procurement and rollout, the UK had at first identified less cases because we focused on vaccinating our older population first. So whereas on the continent, we saw that there were certain age groups that were the elderly originally were left off, and people who were in frontline positions, either in hospitals, care workers, schools, tended to be female. So also some of the patterns that we are looking at now may just be a result of who the vaccine was given to rather than something more significant than that. However, let's not forget there's some countries in the world who have very little or no vaccines at all at this stage. So I do think that certainly this is something that can be overcome. It is damaging, but we know that the real and known dangers of COVID far outweigh any potential adverse effects related to this vaccine, and it fits a typical profile as well.
Jeffrey, many countries are stepping in just right after the findings were released of the EMA, saying that it's about time to start looking for options, particularly for the people under 30. It's very easy said in practice. This means that you have to rethink your whole procedures, your whole strategy, think about alternatives, buy new medicine, which is going to be extremely difficult, particularly in the EU.
So if you're referring to changing the vaccine strategy, I'm not sure it's really that complicated. It just means you're using your Pfizer, Moderna, or your Johnson & Johnson vaccine for those younger age groups rather than AstraZeneca. And like in Spain, where I am now, they've limited AstraZeneca use to those aged 60 to 64. So they'll use up the vaccines they have. Hopefully they'll finish the second doses for those who have only received one dose, and then that will be more vaccines for the rest of the world. What I'm hoping is that we can turn this around and say, given that the European Medicines Agency has said it's safe, we can use this to accelerate vaccination programs in other parts of the world, which is extremely important in order to avoid variants of concern, because as those variants flourish, we risk that some of them may become resistant to vaccines.
Chris, when you have the EU purchasing 400 million doses of AstraZeneca, the Americans 300 million in the past, trying to be ready for the eventuality of starting the fast-track vaccination campaign. What would be the reaction, do you think, among the decision makers now against the backdrop of the findings of the EMA?
Well, I hope they'll look at the statistics, and the statistics paint a very encouraging picture. We're talking here about chance events occurring down at the level of less than 1 in a million to 1 in half a million. That's really, really low. And when you put this up against the fact that the complication we're talking about affects about 5 people in a million per year just by chance anyway, and if people take the oral contraceptive pill, it increases the likelihood of this happening to them by maybe 8-fold, and no one bats an eyelid about that sort of thing. I think that probably most of the people making decisions around this will be saying, well, actually, statistically, we're on a very sure footing here, because what we absolutely know is this is a very effective vaccine. And the data we're seeing coming through now show, in some cases, 90% plus protection in the most vulnerable groups. And it's also very, very cheap. It's one of the cheapest vaccines on the market, and actually has one of the longest track records, because the construct that's being used to make this vaccine has been used for more than a decade. And in the fight in West Africa against Ebola, that construct went into thousands and thousands of people. So we've also got long-term follow-up. So there are many reasons to be reassured by these findings, not least that they're being investigated properly.
Oksana, when you have people who have been from day one skeptical about this whole idea about getting vaccinated against COVID-19 as the safest way, and you get this whole story about AstraZeneca and the link between the vaccination and the blood clots, do you have any concerns that this could unfortunately push some people to start comparing between vaccines and say, you know what, we think that one could be more efficient, safer than the other one?
Well, I think that we have to distinguish between people who are anti-vaxxers, who even before the pandemic would be concerned or refuse vaccines, and those who have some really legitimate questions based on the headlines that they're seeing in the media. And I think Chris really broke it down in a understandable way that there's just a 1 in a million chance of this occurring, which is about the same as getting murdered or being hit by a car in the next month or so. So if we think about it that way, it definitely, I think, eases the concerns that people have. I think what's crucial, though, is that the public's questions on the vaccines, on the data, that there is transparency, that scientists and the governments do address their public regularly so that confidence, that trust can be rebuilt and regained. So I don't think that it is for this middle ground group who just want to understand what it is that the real risk is. I think that that's something that healthcare professionals, pharmacists, doctors can have those conversations and change people's minds that any vaccine at this stage is going to protect themselves and their loved ones, because we see that there's also great data about limiting transmission. It's not just about yourself, it's also about the people around you.
Jeffrey, this looks like a mammoth task ahead for AstraZeneca, particularly when it comes to the American market. The FDA is yet to authorize the emergency use. And we're starting to hear reports from American officials saying that we might not use the AstraZeneca at all by the end of the day.
That's right. And if they don't, then they will use Pfizer, Moderna, and Johnson & Johnson. And like I said earlier, that means more doses of AstraZeneca for the rest of the world. Right now, the vaccine is desperately needed across Latin America, in parts of Africa where they have very, very low numbers vaccinated. So if it means the AstraZeneca vaccine is more available, then that's where it should be distributed, through the COVAX facility or through direct purchase. So I'm not so worried about Europe and the US right now with regards to the AstraZeneca vaccine. I think people should get their second dose. And then we have other options. It's the countries that don't have those other options because they don't have the cold chain to manage Pfizer or Moderna, or because of the cost. So as long as it gets used, we're not facing a severe problem with AstraZeneca.
Chris, the Europeans were hoping from day one that they would have a comprehensive, united approach when it comes to tackling COVID-19, acquiring the same vaccine from AstraZeneca, and moving forward. The Germans are saying now that they are in talks with the Russians for Sputnik vaccine. Could this be an indication that we're seeing some cracks within the EU itself about dealing with AstraZeneca in the near future?
I think we've seen cracks in the EU right from the get-go, and I don't think that they have made themselves look particularly honourable or really bolstered their reputation internationally. I think quite the opposite, in fact. Interesting that they're going down the route of the Russian Sputnik vaccine, though, because A, it hasn't been approved yet. We understand that the EMA, the European Medicines Agency, are looking at that vaccine. It's also very closely related to how AstraZeneca's vaccine works. It's a modified cold virus. In fact, it's a pair of cold viruses which are administered a few weeks apart. It's also very similar to the Johnson & Johnson vaccine. That's also still waiting for approval in the UK. What unites all these different vaccines is they're all based on modified cold viruses, which are used as Trojan horses to smuggle into the body the coronavirus coat message. And therefore, what is happening with AstraZeneca's vaccine, with this rare complication, albeit at very low levels, it could also affect the Johnson & Johnson vaccine. It could also affect the Russian vaccine. We haven't seen the data yet. We haven't seen the follow-up on millions of people who've had it, have had the AstraZeneca vaccine, and that may yet emerge. So it may well be that we see the same trend emerging with these other products subsequently. We'll have to watch this space.
Oksana, where does this leave the EU? It's grappling with a third wave of COVID-19, a spike in infections, death tolls. They've been lagging far behind when in terms of vaccinating large sections of their own society. They have been grappling with ways to find new vaccines. Could this be the moment of reckoning as far as the Europeans are concerned?
Well, certainly the timing isn't great. As you say, there's a third wave that is rolling across the continent, and there are more and more restrictions coming into place, just as in the UK we start to lift some of those restrictions as early as next week. So in this instance, they do need to be accelerating the vaccine rollout as quickly as possible, as Jeffrey has highlighted. However, they do have a selection of other types of vaccines they could also be using. But I believe that they do have to think about how to best leverage their existing public health infrastructure to upskill certain health workers and ensure that they get as many jabs and arms as possible, so that we don't end up in a situation where we have the French variant or the Spanish variant, resulting in the fact of not only combination of vaccination rate, but also vaccine hesitancy. So again, these are all very, particularly the latter is more complicated to address given some of the issues that we've discussed on AstraZeneca. But I think another point as well is that outside of the UK and outside of the EU, Brazil, for instance, being one of the hotbeds of cases at the moment, and that situation is not looking good. So I do think we need to zoom out and take a global approach.
We definitely need to zoom out, and this is going to be my question to Jeffrey about this whole thing has been an uncharted territory for us and for the scientific community, because they're dealing with something new, and they're been trying and testing new vaccines, some of them using old technologies, some of them using ultra-modern technologies. Don't you think that this whole thing about AstraZeneca should be an opportunity for everyone to put into place a mechanism to monitor all the vaccines and look for any possible side effects that we might be overlooking right now?
Absolutely. So we have the COVAX facility, which is a global mechanism for distributing the vaccines to the poorer, low-resource countries. But we need, like you say, a global mechanism to oversee all of the vaccines. We also need that or a similar mechanism to look at production, because where we've failed is in being able to produce enough doses of the vaccine. So governments invested early in developing the vaccines, and this has been one of the great scientific breakthroughs with so many successful vaccines, but they haven't invested at the same level in the production. And we know that vaccines require dozens of components, from reagents to vials and resins and so on. So we need an overview of what the availability of the different components are, and a massive global pharmacovigilance of any possible side effects, since we're seeing some in the EU and the UK, but we need to make sure that we're overseeing this in the rest of the world.
Chrissy, less than 20 seconds, if you don't mind. What would be your message to those bureaucrats and politicians, doctors working in different parts of the world, having to make that decision about allowing their own countries to continue using AstraZeneca or not? Look at the data. The risk profile is exceptionally good, and the performance of the vaccine is very, very high. I have no conflict of interest. I have no shares in AstraZeneca or anything like this, but I do, of course, have a share in being a doctor myself and treating patients who are suffering with this disease, which we can prevent with this vaccine. It's an excellent vaccine. Thank you very much indeed. I really appreciate your messages of hope at this particular moment when people are eager to see light at the end of the tunnel. Chris Smith, Oksana Pyzik and Jeffrey Lazarus, thank you very much indeed for your contribution. And thank you too for watching. You can see the program again anytime by visiting our website, aljazeera.com, for further discussion. Go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Hashem Ahelbarra, and the entire team here in Doha. Bye for now.